Hey everybody, welcome to this brand new series about hip recovery movement. Some of you may have been following along, and I had a hip replacement this year in February that ended up getting infected and had to have a revision in April. I'm just finally starting to find some mobility in my hip, some movement in my hip that feels really good. And so I want to pass along just some tips that come from the lens of yoga and Pilates. I think all movement is really important. I think following your doctor's precautions is absolutely paramount. Following your PT, I just want to give a little slant on how I've kind of endured the horrible pain and lack of mobility over the last 6 months. And we're going to do this in 4 parts. So each part will build onto the next part. We're going to start super small in this very initial kind of getting back tuned into our body. And then by the fourth episode of this series, you will have built a foundation that things that can be done every single day. And then going forward, you can just build upon that. So I want to start by just talking first about the importance of our spine. Our spine governs so much of our health and wellness, and especially when we have a lower extremity recovery. I'm going to talk specifically about hips. We're using walkers and canes. We're learning how to mobilize our body using a device. Usually, when we use a walker or a cane, our shoulders begin to round and we hobble along, such as this. Initially, first couple of weeks out of surgery, we're having to really be guarded in what movements we do, primarily out of pain and also out of legitimate fear, right? It's hard and there's some discomfort that feels different, especially if you have some complications or you've had previous hip surgery. There's a lot of scar tissue, there's a lot of inflammation. Things just happen. So when we think about the spine and the posture in which we need to reacclimate to walking and then getting our lives back, getting in and out of a vehicle, getting in and out of bed, doing everyday things, we have to have a strong spine. I did a video in my hip replacement series on the 6 directions of the spine. We're going to go over that here because that's a foundational piece of this 4-part series that's going to take us into being able to do some bigger and greater things with our body as we move forward. So having those 6 directions is key. And then really tuning into speaking kindly to yourself. As you just start moving your body again, following hip replacement, it is very easy to have language in our head that my hip is killing me. I'm never going to get better. This is horrible. I'm horrible. This was a mistake. And we have those thoughts. I would ask you to just leave them at the door. Let's learn to speak kindly to ourselves so that that mind-body connection starts to integrate. I'm looking at a holistic approach to how do I get my body moving safely, not just my hip, but my whole body kind of back into the game. So that's going to be something that we're going to talk about is speaking kindly. And then our shoulders and our arms are really important to posture because as we tighten here, to carry the walker or to carry the cane, these muscles start to shorten. Then the upper spine starts to round. Over time, if we stay that way, our center of gravity starts to go forward. Last thing you or I want to do is fall. So we're going to talk about shoulders back and down, creating an open chest, why shoulders and arms are important. With all of that, I want you to find a comfortable, upright seated position. Now, if you're still sort of feeling like you need to be in that reclined position that is common post-op, just prop yourself up with some pillows. Be gentle here. It's your body. So you're in charge of what you do. If you're a little bit more further out from your surgery, sitting without support on your back is going to be where you really start to work the spine. But totally go within your limits, your body. Okay, this isn't a race, it's not a competition. Biggest lesson I learned through this whole 6 months is to never compare my experience with somebody else's. Mine is mine, yours is yours, and let's just go. So straight spine. Okay. My sit bones or my butt bones are firmly in the chair. I'm sitting on a metal chair. You could be sitting on a recliner, a sofa, the edge of your bed, something softer, but create a tall spine. We're going to not hinge forwards. We're not going to have that past 90-degree bend, because if you're just kind of getting reacclimated to movement, we don't want to go there yet. Those are some precautions that we have to really pay attention to. Take your shoulders, lift them to your ears, and then tuck them back and then down. Okay, we're going to do this in a little bit of parts. We go up to the ears first, back behind you, and then down. We're going to exaggerate it. Ears, back, down. Two more. Ears, back, down. One more. Up we go, back we go, and down we go. Now, as you are sitting with the shoulders down and away from your ears, take your scapula, those triangular little bones in your back, and pinch them together. So what happens is the heart goes forward. Now, most of us have pain. We have lives. We have things to occupy us. So we're reading, we're on our computer, we're on our iPad, we're being comfortable, which is fine for a while, but look what happens. Then my heart comes in, my chest muscles start to shorten, my center of gravity begins to form as going forward. So I want to counter that for a few minutes every day. So I'm going to straighten my spine, shoulders up, back, and down. And now all of a sudden, my heart's leading the way. My shoulders are directly over my hips. Try to maintain this posture just while we're together here. It's not a big practice today, not a ton to do today. We're just kind of getting into our spine. Take one arm and reach it up to the sky. Take a breath here and then reach over your head and find a side bend. Now, my affected side is my left hip, so I'm lifting my right arm, really feeling a nice stretch through the right side body. Feels pretty good. I'm going to go a little bit deeper and then rise back up and return it. My left hand is going to reach up. This is my side. I'm going to reach up to create some space through my psoas muscle, my ribs, my hip, and then over. Okay, so now I'm starting to feel a sensation because I have a lot of tightness in my left hip. So I'm going to attempt to reach a little deeper until I walk that fine edge. Your edge is different than mine. And then come back. So here we've created two directions of the spine already. We have a side bend and a side bend. Let's twist. Take your hands, clasp them at the wrist. Try to keep your elbows high, and we're going to spin to the right. Follow with your eyes all the way around to your right shoulder. Come back to center. To the left we go. Look over your left shoulder. Squeeze, squeeze, squeeze. One more time each side. Twists are so important, not just for mobility in the spine, but for bringing out some of those medicines that we're on, some of those anesthesia, some of the things that they give us to keep us comfortable can really clog up our pipes, right? And so twisting is like wringing out a towel, massaging those internal organs, getting blood flow back into the liver, back into the intestinal tract, movement, holistic movement, not just your hip. Okay, so we've done one direction, two directions, three directions, four directions. Here comes 5 and 6. This is probably my favorite, feels the best. Locate your sternum right between your breastbone, that little wishbone area. You're going to take that sternum and pull it way in. As you do that, the shoulders come way forward. My hands are going to trickle down past my knees, and then I'm going to tuck my chin. So I've made this beautiful rounded spine. Think about your shoulder blades, the things we were pinching together, and see if you can open them wide. Thoracic spine work, up or back. Now, we're going to reverse that by pushing the heart forward, the belly forward. Now, pinch the shoulder blades, draw a line with your nose and your chin up. Ooh, and then a straight spine. That can give you a burst of energy. That movement in itself, it's big. So those 6 directions of the spine has really nothing to do with the hip if we think only hip replacement, but it has everything to do with total body wellness and getting ourselves prepared to go to the next layer of this 4-part foundation. Okay, so shoulders up, shoulders back, shoulders down, arm up, arm over. Feels so good. Come back up and release it. Other arm, reach up. Over we go. Back up and then down. Grab your wrist. We're going to spin to the right. Spin, spin, spin. Come back to center. Go to the left. Spin, spin, spin. Come back to center. Hands go to your knees. Pull your heart in. Shoulders forward, chin down. Reverse it. Push your heart up. Lift your chin. Lift your nose. Lift your eyes. And return. Okay? Foundational stuff. Take one arm in front, your right one. We're going to open it all the way to the right, maybe even past your shoulder. Notice I got a little twist there. It's good. Bring that arm around all the way over to the left, capture it and squeeze it in. We want to get a nice stretch for the shoulder. Okay, we're going to be using our shoulder and our arm a lot over the next 5, 6, 7, 8, 9, 10, 12 weeks, maybe even more. Open it up. Draw a line all the way back, maybe reach back, twist, opening the shoulder, lengthening those muscles, and then back around. Last time, we're going to squeeze it in. Perfect. Come back to center, lower that arm. Other side, we're going to reach it forward. Open it to a letter T, maybe even behind you a little bit. Feel that stretch there. If our shoulders are constantly rounded, that muscle gets really short. Bring it around. Capture it and squeeze, pull. You feel that through the tricep, through the back, through the rhomboid. One more time, open it. Ooh. And then back. Squeeze. Come back and lower it. Last couple movements. Lots of upper body today, and that's layering on that foundation because not only are we going to need our upper body to transfer from a bed to a chair, from a chair to a bed, into the tub, out of the tub, onto the toilet, out of the toilet, all of it, right? It's a lot of core and upper body strength. We're going to move into the core a little bit more as this 4-part series progresses. We're just starting to find a little bit of fire going on in the upper body because we're going to need it. Take your arms and cross them like fire logs, okay? Spine stays straight. Try not to let this happen. Get really tall, shoulders away from the ears, back and down. You're going to open your arms like a cactus. Pull the elbows back. Squeeze your heart forward. Stack your fire logs. Open like a cactus. Pull back. Mind-body connection here. So you can make this as easy as you want, or you can make it as powerful as you want. We're going to do 3 of these. When you get to the powerful cactus, squeeze your shoulder blades, engage those muscles, then return to fire logs. Open and squeeze. Return to fire logs. Let's do one more. Open and squeeze. Fire logs. And now open to cactus and stay. We're going to tip over to one side. Okay, I'm feeling this on my affected hip side. It feels good. Reach your top arm to the ceiling. Feel that? Come back to cactus. Tip over to the other side. Other arm reaches up, 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 up. Get long. Feel the stretch. Come back to cactus. Now take your arms, cross them at the elbow crease. Give yourself a squeeze. Take your elbows, hold them down towards your belly, round your spine. I'm going to turn so you can see I've got a nice rounded spine there, okay? And now give yourself like the best hug ever, because I read a study, and I don't know if it's real or not, that 10 hugs a day boosts our immune system, helps us feel better, helps our mood, helps our sleep. Squeeze really tight. I don't have 10 people to hug, so I'm going to hug myself. That's okay. Squeeze really tight. This is great for blood pressure, great for regulating it, balancing it, stabilizing it. Squeeze like you mean it. Notice how tight my elbows are. And then open big, get a burst. One more time, cross the other way. Give yourself a giant squeeze. Tuck your elbows, round your spine. Squeeze really hard. Tell yourself something really nice about yourself. That you're amazing, you're strong, you're courageous, you're healing, you're beautiful, you're capable, you're intelligent, you're wise, you're graceful. Squeeze really hard. Then open up big. And then return. Okay, part one is complete. We've touched on our spine. We've moved our shoulders, gotten to our rhomboids, felt some energy flowing through our body. We're going to layer on to part two coming up shortly, a couple days. I want you to practice this for a few days. And then I'm going to come back on for part two. And part two is going to start to address some of the tightness in our hips, our low back, maybe get some hips moving a little bit. It's going to be good. Part three, we're going to be standing up using a chair for support, kind of building on what we've created. And part four will be a little bit of combination. It's going to get clumsy. That's okay. The beauty of videos is you can pause it and then continue on. Okay. So we're going to do a little bit of standing work, a little bit of tuning into the body work. And then we will finish part four on the floor to really get into some leg stretches that you will be able to do pretty much post week two, I think. I guess it's your body, but I think if you can get down and have somebody help you get up or use a chair to get up, that's where we're going to go. Okay, so thanks for tagging along with me. You can find all of my hip replacement videos in this playlist on YouTube. So be sure to go back, maybe to week one. It's like the first one. I'm probably still a little foggy, don't even know what it's about, but then you'll see my progression throughout. I believe there's 12 videos of just that mind-body connection and choice and attitude and mindset, because it's really hard and it gets hard and you're on a roll and you think today's the day I'm going to turn the corner, and then you're back. And how do we deal with that? How do we continue forward? So that's a great thing to just chew on. And then now we're going to get into some movement that's Pilates based and yoga based. Still do your PT, still follow your doctor's orders, but then maybe add in a little bit of this holistic approach. Cool. So that's what I have for you. I'm excited that I'm finally over the biggest hump of my life. I think it was the hardest thing I've ever done. I'm feeling pretty good. I still use a cane for walks. That's okay. It is absolutely okay. I'm able to get down on the floor. It's not so graceful getting up. That's also okay. Finding that acceptance for what is will take you miles in your recovery. So we'll talk more about this in the 4-part series that's coming. But you're doing an amazing job. And I look forward to sharing more of this approach to complement what you're already doing. So take it easy, have fun, enjoy, breathe, speak kindly to yourself. And I will see you in part two. Take care and have a great day. I'll see you soon.